Bruce, as you know better than anyone, Jordan is our expert at WUSA 9 when it comes to combing through a mountain of COVID-19 testing data. Every single day, he posts to our website charts like this one with the latest numbers, plus a look at which direction the trends in each state are moving. Well, check this out. This afternoon, we also called in Dr. Laura Guay. She is a professor of epidemiology at George Washington University, their Milken Institute of Public Health. And she helped us tackle this question. Guay said that while we do want to see the case numbers going down, the increases that we're seeing right now could mean that we're finally testing not just people who are actively sick, but people who may be asymptomatic. Those are the people that didn't qualify to be tested earlier, and having a clear understanding of the number of positive tests, well, that is a key component to being able to reopen.
We know that people who are asymptomatic and have the infection are capable of transmitting the infection to other people. So now, as we expand testing, we're getting a much more accurate picture of the actual number of people out in the population who have the virus, and that we have to be concerned about spreading the virus to others.
Governor Northam was planning to reopen the state based on a consistent decline in the number of positive tests. But here's the thing, there are two types of COVID-19 tests that he included in those numbers: viral and antibody tests. And antibody tests account for 10% of the tests that Virginia previously reported. Given that a drop in the percentage of tests that come back positive is one of Virginia's biggest metrics for reopening, well, Dr. Guay says that the presence of antibody tests in that number is a problem.
If you want to know how many people are out there with the infection that can spread it to other people that we need to be concerned about in terms of controlling the epidemic, those are the active viral tests. The antibody tests tell you, yes, somebody was infected in the past. The antibody tests are less accurate than the viral tests. And so there's a lot of differences amongst them in terms of how you interpret what that means in terms of the epidemic. So combining them means that the answer that you get is not accurately reflecting either of those.
Virginia says that those new numbers released today do still show the 14-day downward trend that the state needs to see in order to reopen. And Governor Ralph Northam has also allowed Northern Virginia, which is reporting about 60% of the entire state's cases each day, to delay phase one.
Okay, Ariane, as you know, our viewers love information. Where can people keep track of that downward trend as the states reopen tomorrow?
Every single day, Jordan updates our website with the latest numbers. He does it for DC, Maryland, and Virginia. He also puts together these incredible graphs, which I wish he could call you guys all and walk you through it because he's really good at that. But it helps you see visually the direction of those case numbers. And you can find all of that information on our website, WUSA9.com, as well as our free app.